very broad collection of specialists, each contributing in their own way to the plan for an individual who has a disability.
We've got an army of people here extremely good at what they do.
What is different about this clinic is the people who come here and the people who take care of the patients here.
Our patients aren't just injured, they are knocked out of their lives. We work with them to rebuild a new life.
Good.
We're going to be the ones who are going to figure out where are the resources for this patient and how can we get them the help they need as quickly as possible. So if we get on top of problems early, we can actually prevent a lot of problems and keep the costs of care as low as possible.
What sort of adaptations you might need.
They understand exactly where I am, understand that I'm coming in with a disability which is different than just turning my ankle and coming in for treatment.
We really have to create an environment of acceptance for them, and our patients get that in our clinic. You know, they don't need to come in and explain their story to us. We understand that. We actually have a provider care team that's a provider, a nurse support, and an RN care coordinator. So between those three caregivers, they kind of become an extension of the patient's health advocate, or they're a family.
A lot of times they'll call and ask for their care coordinator because we're the ones that know them the best usually.
Everybody's been very professional.
Pleasant. I don't know if I could honestly say that we've ever seen anybody on a bad day here.
Left, right, left.
When we first came here, Bob could not walk whatsoever. He had a feeding tube. I don't think there's a therapy they give here that we probably haven't had to have.
I am teaching you how to figure out things again.
From teaching him how to swallow again, teaching him how to walk. Talking was never a problem, was it?
No.
It's rewarding. It's to be able to take the time with the patients to really dig into a deeper level of care and to not just have to kind of touch things on a superficial level and move on with my day.
I wish other facilities or other clinics had a care coordinator. For me, as the caregiver, if I have a problem with a medication, if I'm not sure, it's just one phone call and somebody will get back to me. I don't worry that it's going to get lost in the shuffle.
You know, we always tell people, if you're running into something and you don't know where to go and it's, you know, related to your health or your life, just give us a call.
Yes, this is Kari calling from Courage County Primary Care Clinic.
Our RN care coordinators, they can have days where they literally spend 8+ hours a day on the phone.
And then do you feel safe currently where you're at?
A lot of our care coordinators call patients on a daily basis just to find out how they are. I mean, that means the world to many of our patients because they might not have family. We become a patient's family.
Have you noticed any difference when you move your foot?
I hear it all the time from patients, how grateful they feel about the care that we give.
Med setup. Over here.
Independent living skills is another service that helps people stay in the community and be as active as they can be. That's a service that goes out to individuals' home.
It's for Friday.
Nope. It's for Tuesday the 7th.
With the multiple sclerosis that I have, it's more cognitive, it's more understanding what I need to do when, etc. So that's why that board and that bulletin board help a lot.
Just getting to the clinic is a huge barrier for them. Figuring out how the transportation systems even work. Metromobility is complicated.
I need to call back. I can't remember what he said exactly.
They want to get on with their life. The thing about independent living skills is it helps them to do that, to take it one step further with their recovery of not just fixing a medical problem, but really being able to pursue their hopes and dreams.
I just really appreciate the service. I mean, seriously, I'm living in a perfect place for me.
I think we're on the forefront of approaching care with an understanding that in the modern world, it's a relationship of the family, not just a patient, with a system of care, not just one physician.
Well, I had polio when I was 3 months old, and there's getting very few places that really understand how the post-polio works. I think the regular doctors don't understand it at all.
How is the swimming pool going?
Very good. The doctor that I've got right now seems to be acutely aware of the changes. I certainly don't feel old, and I think a lot of that is because of the care that they're giving me and keeping track of what's going on with my body and addressing any changes.
I feel very honored that they will let us do that, to let us in and trust us with that. And so with that trust, I feel I owe them my very best to make sure they get the best from us.
I take the Metro Mobility, the bus, to the pool. Moving on up, moving on up.
It can take a great deal of courage to just get up and get dressed and get out when that's a 3-hour ordeal.
Alrighty, all right.
And yet people do it every day.
The clinic is very flexible, that if our patient arrives half hour late at a regular clinic, they will never be seen. In our clinic, even if they are 1 hour late or they come in and say, hey, I need to be seen today, we see them. Because we know how difficult it is for them to get to our clinic.
I go swimming once a week. When you sit in a wheelchair all day for like 16 hours a day, and then you get into the pool where it's like zero gravity, it just feels so good on your body.
Bob and I would not be where we are today without Courage Kenny. No bull, it's just flat line. We would not be where we are today without Courage Kenny.